Hello, I'm Dr. Lola Ashaye, and you're listening to Connecting the Dots with Dr. Ashaye. So many studies have shown that people who have fulfilling relationships with family, friends, and their community are happier, have fewer health problems, and live longer. So there was a study of 7,000 men and women in California, and they found, and I quote, people who were disconnected from others were roughly 3 times more likely to die during the 9-year study than people with strong social ties. This difference in survival occurred regardless of the people's age, gender, health practices, or physical health status. So it didn't matter the age, the gender, what they were doing to stay healthy, or what their health status did not matter. Whether that didn't matter, the people who were disconnected from others were roughly 3 times more likely to die, right? So they, in fact, they found that, and I quote, those with close social ties and unhealthy lifestyles like smoking, obesity, lack of exercise, actually lived longer than those with poor social ties but had more healthy living habits. So, of course, if you had both healthy living lifestyles and social ties, you lived the longest of all, right? But the point is, social connection is so powerful. And that's why I saved it for last. So we've talked, this is our last episode of the Health Transformation series. And if you followed us along by now, you should have step-by-step instructions on how to build a solid, strong health foundation. We started out with restful sleep so that we have energy to engage in physical activity. Then we talked about healthy nutrition, and we talked about avoiding harmful substances, so that we don't pretty much counteract all the positive effects of all the other things. Last week, we talked about stress management. And today, I wanted to talk about one of the most powerful foundational tips of them all, which is healthy social connections. And you just heard from the study, it didn't matter what they were doing in terms of keeping themselves healthy. If they didn't have healthy social connections, they were actually still more likely to die. So if this is your first episode though, and you're listening to this series, I encourage you to go back and start with episode 104, because all the things that we talk about here are important to fully optimize our health. We really need all of them to make a strong foundation. So you're listening to Connecting the Dots with Dr. Ashaye. I'm Lola Ashaye. I'm a family medicine and lifestyle medicine doctor and owner of InTouch Primary Care in Sugar Land. And we're here in Texas. And what we do here is we help people become more easily healthy and remain healthy because we have direct access to the doctor and we're very proactive about your health care. So if you're tired about a reactive approach to your health and you want to build a healthy foundation, healthier lifestyle, then our services are perfect for you. So what is health transformation? So we've talked about this, where to transform means to make a thorough or dramatic change. To make a change, it starts with a decision. And with this series, you now have some tools and direction. So the decision part, though, no one can help you with that. You have to decide what you want to do with your health, how healthy you want to be, how to go from here to where you want to go. And you want to be able to take some time to imagine what your preferred future health would be like if you continue what you're doing now versus if you make the changes that are recommended. So if you did make up your mind to, if you've decided that you want a health transformation, then, there are required steps now. And I hope that, the steps that we've shared will help you with that foundation to build that solid, strong foundation so that you can go from there. So positive interactions with others, how it works is it boosts our parasympathetic nervous system, which has a lot of positive health effects. It also increases our positive emotions, which obviously improves our mood. So good relationships gives us a sense of meaning, and it really helps people cope better and be more resilient. so resilient. So many of us know this intuitively. And for most of us, we have a natural instinct to want to connect with people. But I wanted to include this in this series because sometimes we take it for granted. And really, for me, until I did more research on this, I didn't realize how powerful social connections were. And I didn't know how much it affected our health. So I wanted to share with others in case, you didn't know either, so that you were aware. So I see this, between 30s and 60s, especially when ages 30s to about 60 years old, when life gets really busy. A lot of people, a lot of us, we get guilty of taking our loved ones for granted. Maybe we get so wrapped up in meeting our goals, we start to neglect people around us. And then years later, we look up, we look around, and we're all alone. So that's not what's going to happen here. Now that we know that healthy social connections are important, we're going to take them seriously. So if you know someone that needs to hear this, please go ahead and share this episode with them now. You can also subscribe. When you subscribe, share, and like, you're telling other people that this is good information that they need to hear and that could improve their health. And I want to thank those who already subscribed. I really appreciate it. I appreciate you supporting our mission to make healthcare, basic health information, preventative health information available to those around us. It's really a small action that can make a big difference. So, as I mentioned earlier, it is possible to do all the foundational lifestyle behaviors and then neglect this positive social interaction thing, and it negatively affects our health. Strong positive social connections are so powerful that it can reduce the risk of death in people with serious conditions. For example, there was another study published by the New England Journal of Medicine of over 2,000 men that had survived a heart attack. And they followed them over 3 years. They found that those who had strong connections with others had a quarter of the risk of death compared to those who did not have social connections. So there's another example of where people that had strong social connections did much better than people that did not. People that lack social connections have more stress and inflammation. And as we've talked about in the last episode and other episodes, these stress and inflammation are associated with many conditions: diabetes, hyperpressure, heart disease. So when people do not interact with other people in a positive, healthy way, it does affect them, negatively. So the other thing is when people interact positively, so when we have positive social interactions, it actually can lead to positive behaviors just by association. So for example, if most of your friends eat healthy, right? Or you are more likely to start eating healthier. If you join a group of people that exercise regularly, guess what? You're going to start exercising regularly soon, So that's how it works. Like who the people you're around with are going to influence your behaviors. So if you don't have any friends that smoke, for instance, and you're a smoker, well, over time, chances are you're going to quit smoking. So in addition, when we're surrounded by people that are supportive, that are helpful, that allow positive social interaction, emotional well-being is better, and we're able to handle stress much better. So that is another reason why positive social connections are so strong. So we've discussed many important foundational lifestyle behaviors in this series. And while we're talking about eating healthy, sleeping well, exercise, stress reduction, avoiding harmful substances, we really shouldn't forget about positive social connections because they are so powerful. And by really leaning on positive social connections, we can truly optimize our health. It's not just, it's so beneficial, so it's so worth it. So that we've come to the end of our life transformation series, a health transformation series, excuse me. And I hope it's been helpful. I hope you've made decisions. I hope you have steps that you can take to, build a strong foundation And if you're in the Houston area and you feel like you need more support, you've heard these tips, you know that you'll benefit from them, you need more support in your health journey, you want to work with a doctor who's proactive about your health, then contact us at InTouch Primary Care. Ask about our waiting list for the Lifestyle Foundation program starting September 2024. And you can also go on our website, learn about our other services, and go from there. All right. So imagine this, you're prioritizing your health. You started a consistent relaxation behavior, and now you quickly and effectively deal with things. You've learned how to eat, better. You've asked yourself the 3 questions. Listen to the video to learn what those are so you can eat healthy. You're consistently exercising, you're prioritizing sleep, you know what's harmful, you're avoiding it. Guess what? You're going to feel so much better. You're going to be in a much different place this time next year. So don't wait to start. It's really worth it. When we make these types of lifestyle changes, they affect our health positively. They affect us positively because our bodies act better. They affect our loved ones positively because we're around longer and we're nicer, we feel better. So it's certainly worth the time and energy to do these foundational things. And then we can build on top of that if needed. I hope this helps. Until next week. Bye-bye.